Hi, my name is Jordan Januso, and I will be presenting my 5P signature assignment on the child welfare system. And I wanted to show my background because April is Child Abuse Prevention Month. And in Kentucky, we're trying to promote that and make people more aware of child abuse and neglect in order to help prevent it in the future. So let's go ahead and get started. For my chosen passion for the 5P assignment is the child welfare system, and Kentucky's child welfare agency is called the Cabinet for Health and Family Services. And specifically, the Department of Community-Based Services is the agency that investigates reports of abuse and neglect. This is significant to me or meaningful to me because I am employed by the Department of Community-Based Services, or DCBS for short. I have worked for this agency for nearly 3 years now, and during my undergrad, I was accepted into the Public Child Welfare Certificate Program, and this program offered to pay for students' college in return for 2 years of service at the cabinet in the Child Protection Branch. So therefore, I accepted a job in Jessamine County in Kentucky, and that's where I was an ongoing worker. I assisted birth families in their journey to reunification, while also ensuring that the children who were away from them, all their needs were being met in their alternative placement. Then I transferred to the recruitment and certification team, where I now recruit, train, and certify foster parents for DCBS. So helping families work with this agency is my passion, and it's hard for me to even imagine doing anything else. According to the Children's Bureau, the state of Kentucky maintained the highest child abuse rate in the US for 3 years in a row. However, we are seeing some improvement. The 2020 report indicated a 3.3 decrease in Kentucky's child abuse rate, now ranking Kentucky as number 5, the 5th highest child abuse rate in the country. In regards to profession, the NASW supports many of the ideals of the Child Welfare Agency. Specifically, they support prioritizing children's safety, well-being, and permanence while respecting civil rights of the birth family and the children. They also support keeping siblings together if and when possible, and maintaining child's familial connections and bonds. They support prioritizing relative and kinship placement before considering a foster home or group treatment setting to try to keep those connections for those kids. Our agency offers preventative services to families, like in-home behavioral health services, to help keep parents and children together instead of separating them or removing the children instantly. And also, NASW supports engaging foster youth in the decision-making process that affects their lives, and also offering them services until the age of 18. In regards to the ethical principles that the NASW Code of Ethics correlates to the child welfare system, I think that all of them relate to it. Starting with service, I think service might be the agency's most obvious value, as the Child Welfare Agency strives to help and serve children and families in need to address child abuse and neglect. Furthermore, social service workers strive for social justice by ensuring clients and families have equal opportunities to access services and resources. It's our job as the social service worker to find services for these clients and to advocate for what's best for them. Also, our workers must treat families with respect and dignity, despite how the family treats us, or despite what the allegations are. We must remain respectful. And we also must must maintain and create good working relationships with members of the family, as well as other collaterals, other people in the community, to build trust and to ensure that all of the family's needs are being met. As professionals, child welfare workers are also expected to maintain their integrity with the work that they do and through their practice. Remaining trustworthy is critical when trying to form a relationship with members of a family. It's also very important because the judge and the court system expects social service workers to report honestly and justly regarding the family. And lastly, workers must maintain their competence as policies, practices, and situations are ever changing. So overall, the Child Welfare Agency, when they are investigating reports of abuse or neglect, they determine if the children in the report are in imminent danger or if services can be provided to the family without removal of the children. This is an initiative that we hope to see further be invested in. If children cannot remain in the home, if there is imminent danger to the children, they will be temporarily placed with relatives, fictive kin, or foster parents, or even in a treatment facility. But the social service workers will work with that biological family and also the placement, the children's placement, to promote reunification. Over time, a family court judge will determine if the biological parents have completed the appropriate tasks to reunify with their children, or if another permanent option like adoption needs to be considered for that child. With nearly 10,000 Kentucky children living in foster care currently, it's critical that social service workers can clearly differentiate between abuse and neglect, as well as understand how abuse and neglect differentiates from poverty or financial insecurity. Overall, we hope to see a deduction in the wrong children being removed, and an increase in services, in-home services and preventative services provided to our families. All right, so the policy that I have selected is Kentucky's Senate Bill 8. And this was proposed on January 20th during Kentucky's 2020 regular session. This legislation will create a uniform definition of child abuse and neglect that clearly differentiates between neglect and poverty. Will establish new membership of the state Child Abuse and Neglect Prevention Board to meet and discuss cases. Will ensure victims of child maltreatment have access to critical medical examination. They're not stopped by financial, they're not prevented to complete this just due to financial concerns, and broaden the definition of fictive kin, and also expand opportunities for youth who age out of foster care. So this bill was created overall to strengthen Kentucky's efforts to support children who have experienced abuse and neglect. Senator Adams, who proposed this bill, she had stated, quote, Senate Bill 8 incorporates in the input and feedback from various agencies, advocates, foster youth, and community partners. She went on to say, quote, Senate Bill 8 has been developed in consultation with the Attorney General's Office, the Cabinet for Health and Family Services, the Administrative Office of the Courts, Child Advocacy Center, and other child welfare agencies. Also, Republican State Senator Ralph Alvarado He had stated that, quote, we're going to hear a lot of things this session, and I would agree. I would argue that this will probably be the most important bill we pass this year. In regards to what we hope to see within this bill, there's a very personal story to this one. So Senator Adams actually heard straight from foster youth alumni in regards to changing certain aspects, certain policies to help provide them services after the age of 18. And specifically, she spoke to foster youth alumni Tamara Best here. Tamara, she graduated college and actually became a social worker to advocate for kids. And she was also a member of the Voices of the Commonwealth, which is a group of current foster youth and foster youth alumni who advocate for different policy changes that directly affects them or affected them during their time in care. And Tamara, she now coordinates an independent living program at Murray State University for foster youth. She spoke in favor of allowing youth to choose to remain in or return to foster care up to the age of 20. With this bill, it now allows children to remain in foster care up to the age of 21, as long as they make that decision before turning 19. And Tamara said that she was in foster care for 9 years and she was just ready to exit when she turned 18. She said that she was that hard-headed 18-year-old that had been through years of foster care and had my life controlled and was ready to be in control of my own life and my own decisions. She said, I learned very quickly it is so hard when you age out of foster care without those supports and those connections. So Tamara said that on her 19th birthday, she requested to return to the foster care system and was told that she missed a deadline. So she is hoping to continue to advocate for foster youth after they exit care. In regards to intersectionality, changing the definition of abuse and neglect to make it clear that poverty alone is not a reason for removal, but rather a finding of abuse or neglect would be allowed when parents or other caregivers are financially able to provide for a child, but fail to do so. After assessing who opposes this policy, I did not find any information or any person that that publicly opposed this bill. Several senators on the committee expressed their full support for it, but added that Kentucky needs to keep working on the underlying problems of addiction, mental health, and poverty that affect child abuse and neglect. Furthermore, with this bill, it was passed. It was signed by Governor Beshear on April 1st of 2020, which was a great success for the Child Welfare Agency, the child welfare system. And the senator who proposed this, Senator Adams, stated that Kentucky will not get to our levels of child abuse, did not get to our levels of child abuse and neglect overnight. She said, I want to make it clear and temper expectations. And Senate Bill 8 will not fix things overnight. She said, this will take time and will require us to maintain intentionally committed to the effort of protecting children. So this is a great step. This is a step in the right direction, certainly. Senator Julie Rocky Adams was my chosen person for this project for obvious reasons, since she was the one who presented this bill and was a supporter of it. But further, she is on the Kentucky State Senate representing District 36. She's also the co-chair of the Child Welfare Oversight and Advisory Committee. And she assumed office on January 1st, 2015. And her current term ends on January 1st, 2023. But Adams is running for re-election to the Kentucky State Senate to represent District 36. She is a part of the Republican Party as well, and it is clear that Senator Adams supports the Child Welfare Agency and their workers. She says that child welfare belongs to all of us in every district across the Commonwealth. Adams said in a statement after the hearing, she said, "This is a first step to clean up and expand our statutes, get our regulations into conformity with statute, and change current policy to change the lives of our abused and neglected children." And furthermore, she is very supportive of helping child welfare workers, and she understands the many issues that we face when trying to serve our clients. And so she said that investing in our state's social service workers who invest in the lives of our families and children is critical towards preventing child abuse and neglect. She says providing our social service workers with the resources they need to effectively serve our communities will ultimately result in more safe, healthy children and thriving families. And so, further, Adams said that Kentucky's persistently high national standings in its rate of child abuse and neglect mean that the state must not delay in taking more steps to address it. And since Senator Adams sponsored this bill, I would provide my additional support to her through the implementation of the bill changes. I'd also work with Senator Adams with investing in my social work colleagues. I would also tell them about the sponsored bill. I would continue to engage with Senator Adams through social media or sharing content about the bill or other things moving forward. All right, practice. So the movement that I have chosen that is working to address the passion, my passion of the Child Welfare Agency, is the Face It movement, a movement to end child abuse and neglect. So this is a COSAR Charities movement, the Face It movement, and it's a collective of partners across the state of Kentucky with the primary focus of ending child abuse and neglect. The Face It movement have been engaged in work since 2013, and the Kentucky Youth Advocates are the backbone of this organization. But it really is a collective of many partners and who work with families and children in different capacities. But the Face It movement focuses on a three-pronged approach to address child abuse and neglect. One is to promote best practices in child abuse prevention and intervention. Also advocate for effective policies to improve the child welfare system, and build awareness and engage in the community. Face It offers child abuse prevention trainings at no cost to staff and volunteers at youth serving organizations. Therefore, I could inform more organizations within my region of this great resource and try to encourage them to maybe schedule a free training. They also offer tools and resources that encourage the community to support families and keep children safe. And so I could share their materials with other local organizations. In regards to policy, their policy team works to identify and advocate for needed state and local policy changes around prevention, recognition, and intervention. FACE IT has advocated for state funding to keep families safely together, as well as state policies to reduce deaths from pediatric abusive head trauma, and many more. I connected with this movement through their website. I signed up for their email list and also followed their Twitter and Facebook page. And they're very involved in all of this. So for my interview, I intended to interview Shannon Moody, who is the Chief Officer of Strategic Initiatives at the Kentucky Youth Advocates. And she's also an author and an advocate of the FACE IT movement campaign. This interview did not occur, unfortunately, just due to not reaching out quite soon enough. However, Shannon Moody was interviewed by Renee Shaw from KET on April 10th, where she talked a lot about the Kentucky Youth Advocates, the FACE IT movement, and how it relates to Senate Bill 8 passed by Senator Julie Rocky Adams. And Shannon Moody indicated in the interview that Senate Bill 8 was a policy priority for the FACE IT movement. And she reported that if the bill is implemented well, that we're likely to see a lot of benefits to the child welfare system. And Shannon Moody also complimented Senator Julie Rocky Adams and her staff for being thoughtful about the way the bill was put together. And she just went on to say that she hopes to see a deduction in the wrong children being removed based on the wrong reasons, and hopes that clarifying neglect versus poverty will certainly help that. And Shannon also talked about the free resources that the FACE IT movement offers to agencies that work with children and families. All right. And so furthermore, in conclusion, talking about the next steps for this passion, Senator Julie Rocky Adams stated that Kentucky did not get to our levels of child abuse and neglect overnight. She said, I want to make it clear and temper expectations that Senate Bill 8 will not fix things overnight. This will take time and will require us to remain intentionally committed to the effort of protecting our children. So this is a great step in the right direction, but there's a lot of work to be done. And throughout this project, I learned that about the multitude of organizations that I'd never even heard of that are advocating for policies that affect my profession and the clients that I work with. I think that I tend to get so overwhelmed in my work that I don't seek out other organizations or other resources that could help me or that I could be involved in. And so with that being said, I certainly hope that I continue to engage with Senator Julie Rocky Adams and continue to stay up to date on policy changes that impact the clients that I work with and the children, and that I continue to share what I learned with my colleagues as well. Also, Senator Adams wrote that she said, I have concluded that the best first step we can make towards preventing child abuse and neglect is investing in our child welfare workforce. Since the October hearing, I have received letters from state social service workers from across our Commonwealth urging our attention to their critical needs for additional resources and supports. We must identify and implement innovative recruiting and retention strategies to build and maintain our child welfare workforce. Leveraging community supports, resources, and partnerships are also a valuable way to support our state social workers, as well as our families and children. Investing in our state social workers who invest in the lives of our families and children is critical towards preventing child abuse and neglect. and providing our social service workers with the resources they need to effectively serve our communities will ultimately result in more safe, healthy children and thriving families. So it's very obvious that Senator Rocky Adams is supportive of the Child Welfare Agency and hopes to continue to make improvements for the child welfare workforce. So that concludes my presentation, and I enjoyed learning more even about my own profession and the policies that impact it. So thank you.